listener production.
Hi, Natarsha Belling with you and welcome to the afternoon edition of The Briefing. Coming up in our deep dive, skyrocketing specialist costs. Why a growing number of Australians now cannot afford to pay for expert medical care and treatment. We unpack the concerning lack of transparency on why specialists charge so much and what your rights are when it comes to medical care. But first, let's check the afternoon headlines this Tuesday, the 11th of November. The retiring president of the RSL has called on the federal government to support the Australian Defence Force in the future. Major General Greg Mellick delivered the commemorative address at Remembrance Day at the Australian War Memorial in Canberra this morning and honoured the service and sacrifice of all Australians in uniform. The Major General also warned against complacency in modern times.
Today should not only be a day of remembrance of past achievements, we also must remember the lessons of past conflicts to ensure we are appropriately prepared for what the future may bring.
Australians have paused across the nation to mark Remembrance Day, paying tribute to those who have died serving in wars and peacekeeping operations. Today marks 107 years since the armistice ended World War I. US President Donald Trump has reportedly asked the Supreme Court to overturn a verdict that found he sexually abused and defamed writer E. Jean Carroll in the 1990s. A federal jury previously found that President Trump sexually abused Carroll in a Manhattan department store dressing room and then defamed her when he denied a claim in a 2022 social media post. He was ordered to pay more than $83 million in damages across two trials. According to US political media outlet The Hill, Trump's legal team filed a petition arguing that Carroll's claims are, quote, facially implausible and politically motivated. Federal appeals courts have upheld the verdict and jurors did not find that Trump committed rape but awarded Carroll damages for sexual assault and defamation. And the Wiggles may have breached consumer law by selling headbands without mandatory safety warnings, according to the consumer watchdog. The Emma Bow headband, sold between 2022 and 2024, lit up using button batteries, which can be a serious choking hazard for young children. The Wiggles say the product was manufactured and supplied by a licensee before new labelling rules came into force and regretted that leftover stock had not been updated. The ACCC advises anyone who still owns the headbands to refer to the recall notice for returns and further information. Now it's time to get into our deep dive on skyrocketing specialist costs with health reporter Natasha May. The Guardian has found specialist fees are increasing faster than inflation, pushing patients to delay critical care. Its investigation found some patients are reporting a 10-fold price difference, with one family admitting it costs around $1,000 for a 1-hour paediatric visit in Perth. Experts warn higher Medicare rebates alone won't fix it unless fee transparency and specialist supply improves. The Guardian's health reporter, Natasha May, joins us. Natasha, thanks so much for joining us. We know medical costs, including even visits to a GP, are skyrocketing across the country at the moment, but you've done this great investigation into why we're also seeing the cost of going to a specialist. That's soaring as well. Tell us about what you found.
What we're finding essentially is these are some of the most expensive doctors that you can see, and they've done a lot of medical training, so they rightly need to be remunerated, but some of these fees are just really, really extreme. We're seeing examples of $1,000 for a 1-hour appointment to see a pediatrician, and a lot of families are struggling, and it's kind of a two-sided coin because the public system is supposed to provide a safety net so that people that can't afford the private system can have somewhere to get good care, but what we're seeing is that the private fees are skyrocketing, but the public system is also buckling. People are seeing really long wait times and they're struggling to access that. So it's a double-edged sword, essentially.
So can you just unpack that for us? The public system, which we know we're very lucky to live in a country where there is a public health system, can I access a specialist through the public system, or am I now forced to pay basically private fees to see a specialist?
So one of the things that I wanted to do an explainer to talk about what options people have, you can ask your GP to refer you into a public hospital to access that system. But one of the problems experts say is that the system is sometimes quite bureaucratic, that they find that you can get knocked back because of a bureaucratic reason instead of a clinical one. And so it can be quite hard to get in, and you might find that the wait list is really long. So the public system is there, but because of these difficulties, people are often forced to go to the private system and pay these huge out-of-pocket fees, even if they really can't afford them, or are struggling to have to cut out other things like food, or their budget for, if they're retirees, their budget for their home maintenance. And we hear lots of stories like that from doing a reader call out, which was the basis for this investigation.
Natasha, we know if you're going to see a specialist, often you need proper help or expert care for a serious health problem. If you're an elderly person, or if you're a parent with a child, when you're going to see a specialist, you need that expert advice. And sometimes you would have seen other specialists and not get an answer. So it's really quite manipulative that they're charging this, because you obviously need to see that specialist. And if you can get an answer, that's incredibly important. But then they're almost targeting those vulnerable people, aren't they?
I suppose it's an issue where there's definitely some doctors that are trying to do the right thing, in terms of, we've heard that there are some specialists that will bulk bill patients, but we are seeing these extreme fees, and the data does back up the fact that even in low-income households, they are having to pay these huge fees. So we know that it's not a situation that sometimes these financial considerations are being taken into account properly.
It's great you mention in many circumstances that the specialists are doing the right thing and trying to keep their fees down. But what were some of the worst fee increases you saw? I believe there was one that was a paediatrician that a parent had gone to manage their child's ADHD, and there was a 30% increase, 36% rather, increase in fees.
Yeah, so this clinic already had some pretty steep fees that these parents were paying, but all of a sudden they got a letter in June saying that the fees were going to go up even higher, and that for a 1-hour appointment, it was going to be $1,000. And so the parent that I spoke to, her son has ADHD and autism, and what she said is that they have just gone through the process of him getting that autism diagnosis, and it required these kind of lengthy appointments. And so they're lucky that that diagnosis has happened. They're kind of hoping that they're just going to be able to make do with 15-minute appointments, checkups from now on, because that's such a high fee. If they were to need these lengthy appointments, they're just not sure they would be able to afford them.
And what did your investigation find, Natasha, with the transparency with these fees? If the fees are increased, did they give any explanation why they may have increased?
So a lot of times these are businesses, and they do face the kind of inflationary costs that we've seen across society, essentially. But medical inflation has been rising faster than some other areas. And so things like electricity, rent, the cost of supplies, these are factors that it's true that they're going up. And these are also some of the factors why the public system is also buckling, because they're also having to pay these higher costs. And so that is a real factor. And we do know that that's occurring. But at the same time, I spoke with Elizabeth Devaney, who's the CEO of the Consumer Health Forum. And what she was saying essentially is that when these costs are rising faster than inflation and people are having to go without care, we can't keep just saying that in every case it's business costs.
And I noted in your article that you just spoke there about Elizabeth, who was the chief executive of the Consumer Health Forum. She said, quote, and I think this is a great quote, "You shouldn't have to win the lottery just to see a specialist for care. Knowing the fee isn't enough when you can't afford the service." That's awful, isn't it?
I know. I think it really does speak to kind of the situation that we're in that I think everyone who's gone for an appointment and gotten a huge bill sometimes wonder, how is everyone else keeping up with these costs? Because they can be so huge. And like you were saying before, it's often the worst day of someone's life when they're needing to go see a specialist. These appointments often aren't optional because it's your health at the end of the day.
So through your investigation, Natasha, I understand you've got a number of other articles coming out because you've written this great piece for The Guardian. What would you say to people right now? It's all about making an informed decision and being able to be your advocate saying, well, hang on a minute, I need some transparency on exactly what I'm paying for here.
Yeah, absolutely. So I think there's a couple things that you have every right to do. And one of those things is actually if you've gotten a referral to see a certain specialist, even if they're named, if you shop around and can find out there's another specialist that is more affordable, you have every right to take your referral to them, even if their name is not the specialist that's on your referral. The only exception to that is if you are wanting to be treated as a private patient in a public outpatient clinic. And so that's just one example of kind of knowing what your rates are that you can shop around. One of the only difficulties with that is actually knowing what the different prices are in your area. And often, sometimes they're big care deserts, or some people, sometimes that's their only option. But in terms of actually finding out what's out there, often you literally would involve ringing around, shopping around, calling up the specialist because we don't know what individual doctors are charging. Now, the government does have that information, but they don't publish it for legal reasons, and they've promised to actually introduce legislation that's going to allow them to publish it quite soon, and that would actually allow people to see what individual doctors are charging. Because at the moment, there's this medical cost finder website, which has been the subject of some derision because it's voluntary for doctors to put their fees up. And it's been a very, very slow uptake. The last I asked the health department in August, it was only 86 doctors who'd put their fees up out of 11,000 specialists across the country.
So it's actually not really effective. It's voluntary to start with. And you just mentioned only a small minority of doctors are actually putting their details there.
Exactly. So it's a situation where this is why the government has said that they are going to introduce this legislation that's going to give them the power to put the fees up on the website without needing to ask the doctors to put their fees up, because at the moment they haven't really been willing to come to the party and be more transparent with patients.
We also know it's incredibly difficult in many circumstances, Natasha, to get into a specialist. And as you know, often that can be really life and death for some people, especially if they're going to see a cancer specialist or they have a serious disease and need to get an opinion. Is it okay as a patient to actually ask when you're making that appointment, can I please check what is the fee that will be charged for this?
Yeah, absolutely. That's one of the fundamental rights you have as a patient, like to that transparency. And the clinic should also be trying to tell you the fee ahead of time so that you're not put in the position of having to ask or be put in a position of bill shock.
Really, really great articles and great investigation. We really appreciate your time, Natasha. Thanks so much.
Thanks so much for having me, Natasha.
That was health reporter with The Guardian, Natasha May. And that's it for this episode of the afternoon edition of The Briefing. We'll be back tonight with an episode of The Beefing on Steve Jobs versus Bill Gates.
They were both college dropouts, both started their companies with a friend, and both went on to become the two most powerful figures in tech. But the pair also created one of the biggest rivalries in the tech world, the battle between Apple and Microsoft.
And we'd love you to subscribe or follow us on Instagram at The Briefing Podcast. I'm Natarsha Belling. Thanks for your company.